Before entering the room, I'm going to go ahead and gather my supplies. I have my clean gloves. I have my extra pair of sterile gloves. I have my bio patch. I have my dressing kit. I have the mask that I'm already wearing and the mask that I have supplied my patient. So now that I have my supplies, I'm going to go ahead and enter the room. Knock, knock, knock. Upon entering the room, I'm going to go ahead and perform hand hygiene for a full 20 seconds. Good afternoon, Mr. Jones. How are you doing today? Very good. My name is John Michael Lozada, and I will be your student nurse today. Can I have you state your name and date of birth for me? Thank you so much. Let me go ahead and scan your armband. Okay, that matches. Now, Mr. Jones, today we are going to be changing the dressing on your central line. We do this as per hospital protocol every 7 days to prevent any contamination or infection. Now, Mr. Jones, do you have any allergies that I should be made aware of, specifically to chlorhexidine, latex, or tape? None? Are you experiencing any pain today? No pain? And do you have any questions or concerns about today's procedure? No questions? So you have a pretty good overall understanding of what we will be doing today? Very good. Now, Mr. Jones, if you experience any discomfort throughout the duration of this dressing change, please don't hesitate to let me know. So I've already washed my hands. I'm going to go ahead and don a pair of clean gloves so I can begin to prepare my workstation. So I'm going to start by wiping down the tabletop for a full 30 seconds with a piece of sandy cloth. Starting now. Making sure not to only get the tabletop itself, but also the edges. Okay, I'm going to go ahead and dispose of that. I'm going to allow it to dry for a full 2 minutes. Okay, 2 minutes has passed. I'm going to grab my materials here. I'm going to place them on top of the table. I'm going to doff my gloves. I'm going to perform hand hygiene, 20 seconds. And now I'm going to place the patient in a position that's not only comfortable for him, but in a way that will allow me to easily access his central line. So he looks like he's in already a pretty good position. And I'm also going to ask Mr. Jones that you wear a mask and that you turn your head to the side. Is it okay if I assist that with you? Okay, thank you. And the reason we do this is to prevent any contamination during the dressing change itself. So I'm going to, since I touched the patient, perform hand hygiene 20 seconds. And now I'm going to go ahead and get my dressing kit and open it. I'm going to carefully open it, making sure to only touch the outer rim. And I see that there is a mask here, but my patient already has a mask, so I'm going to go ahead and gently grab that out. I'm also going to grab my sterile gloves and set it off to the side. And now I'm going to go ahead and drop my bio patch at an angle as to not hover over the sterile field. Okay, now that I've done that, I'm going to go ahead and perform hand hygiene. 20 seconds. I'm going to don a pair of clean gloves. And what I'm going to do now, I'm going to assess the external measurements of the catheter itself. Now I'm comparing it to what was previously charted. It was last charted as 5 inches, and I'm confirming that now that it is also 5 inches here. And the reason we check for that is we want to see that the sutures are still in place and the catheter itself hasn't moved. So now that I've confirmed that, I'm gonna go ahead and begin to remove the dressing. Again, Mr. Jones, if you feel any discomfort or pain as I remove it, please let me know. And I'm also going to stabilize the catheter itself as I remove it, again, so the catheter doesn't move from its place. How are you doing, Mr. Jones? Not too bad, right? Okay, so now that I removed the original dressing, I'll go ahead and dispose of that. And now I'm gonna assess the skin. So I'm looking for any signs of infection. I'm looking for any redness, inflammation, swelling, or pus. And the skin appears to look normal. And I'm also checking the tubing. So I'm looking for any cracks or leaks. The tubing itself appears to be intact. So now I'm gonna go ahead and doff my gloves. I'm gonna perform hand hygiene, 20 seconds. And now I'm going to begin to don my sterile gloves. Also making sure to only touch within a 1-inch border of the wrapper, since that is considered unsterile. Okay, so now that my gloves are on, I can go ahead and fix the fingers if need be. And I'm gonna fix the cuff, making sure to only touch the outside of the glove and not the inside. Okay, so my cuffs are fixed, my sterile gloves are on. I'm gonna go ahead and pinch the middle of the wrapper and dispose of it as so, making sure not to drop my hands below my waist to maintain sterile feel. Now I'm gonna grab the tubing with my non-dominant hand. I'm confirming now that there's a cap and a clamp in place as to prevent any contamination from entering in. Also, I wouldn't say this to the patient. It also prevents air from going in to prevent air, which would cause air embolism. So now that I have that, I'm gonna go ahead and grab the chlorhexidine. I'm gonna crack it. And I'm going to wipe within a 2-inch border of all 4 corners for a full 30 seconds, starting now. How are you doing, Mr. Jones? Not too bad, right? Okay, so now that I have wiped all 4 corners, I'm gonna go ahead and wipe the tubing itself from bottom to top. Right side, left side, back, and front. I'm gonna dispose of the chlorhexidine. I'm gonna allow it to dry for a full 30 seconds. Okay, 30 seconds has passed. I'm gonna go ahead and grab my BioPatch, making sure to only grab the top of the BioPatch. I'm gonna place it like so. And next, I'm gonna grab my Tegaderm, making sure to only grab the very tip of the wrapper so I don't touch the Tegaderm itself. now that the Tegaderm is on, I can remove the wrapper. The sterile procedure is over. I'm going to go ahead and secure the tubing with a piece of tape. And I'm going to tape it in a way that will raise the tubing itself away from the skin, slightly elevated, like so. And this is called the butterfly technique. Okay, and now that I've done that, I'm going to go ahead and label it. So I'm going to write my initials, JML, the date, 9/17/2022, the time, 1500, and I'm going to go ahead and label it. Okay, so now that I've done that, I'm going to go ahead and grab all my supplies here. I'm going to dispose of that. I'm going to dispose of my sterile gloves, perform hand hygiene, 20 seconds. And now I'm going to go ahead and assess the site one more time. Again, no redness, no swelling. Everything is intact. Everything is in place. Mr. Jones, I'm going to also check up on my patient. Mr. Jones, how are you doing? You can go ahead and turn your head to the side, to the front now. Can I assist you with that? Okay, thank you. Okay, so Mr. Jones, do you have any questions or concerns about today's procedure? Are you feeling any pain whatsoever? No? Okay. So once again, I'm going to go ahead and put the call bell right next to you. I'm going to put both side rails up. I'm going to put the bed in its lowest position. And since I did touch you, I'm going to go ahead and perform hand hygiene. Okay. And upon leaving the room, I'm going to go ahead and document the date and time, who performed the procedure, which was myself, John Michael. And I'm also going to document the assessment of the site. So once again, there was no redness, no swelling, no inflammation. The tubing was intact. And I'm also going to document the patient tolerance. Mr. Jones tolerated it pretty well. He experienced no pain during the dressing change. Thank you.